Bonjour à tous, bienvenue à cette conférence de presse pour faire le point sur la situation de la COVID-19 au Québec. Aujourd'hui, le Premier ministre du Québec, M. François Legault, est accompagné du ministre de la Santé et des Services sociaux, M. Christian Dubé, du ministre délégué à la transformation numérique gouvernementale, M. Éric Kerr, et du directeur national de la santé publique, Dr Horacio Arruda. Je cède maintenant la parole au Premier ministre.
Oui, bonjour tout le monde. C'est quoi qui fait ce bruit-là?
What's making that noise?
Bon. C'est beau. Bonjour tout le monde. Ben, écoutez, peut-être avant de vous parler de la COVID,
before we talk about COVID, I would like to tell you that I had a meeting with the Atikamekw chiefs this afternoon, a very good meeting actually. We agreed that we would meet more often, the chiefs with the minister, amongst others, and we also agreed on a few priorities. First of all, to make sure that we train staff at the Joliette Hospital, because it was completely unacceptable what happened at the Joliette Hospital last week. And then to make sure as well that there was some training given in all the networks, so not just the health network, but also the other government networks. We also agreed to work together on an awareness campaign for Quebecers to fight racism, because it's truly time that we act and that we don't just talk about racism, but that we be able to act. And we have to remind all Quebecers that First Nations were here before us on this vast territory in Quebec. They helped us as well in many ways. There were all sorts of relationships between the First Nations and the first who arrived here in Quebec and Canada. I'll give you my example. One of my great-grandmothers, or great-great-great-grandmothers, her name was Marie Mitiwi Migou. And she was an Algonquin. And there are many Quebecers like this who also have First Nations roots. So I think that Quebecers are capable of making an effort, once again, to raise the awareness of those who are still racist, and to repeat and repeat that all humans are equal. I was happy with the meeting, happy to see as well that we promised that we would see each other more often so that we could advance, make progress on the recommendations of the Vien report, and to act. I'd like to come back to the pandemic now. You can see with the numbers, the situation is still very critical, more particularly in certain regions, in the Greater Montreal region in Quebec, Chaudière-Appalaches, and even in certain places in the Gaspé region, which we added to the red zone. This is what brings us, since last week, has brought us to increase, unfortunately, the restrictions, to add some rules. You saw this afternoon, our colleagues in education, in sports and leisure, announced that, unfortunately, we must prohibit team sports and prohibit gyms. And we don't do this happily. I'm a guy who likes sports. I played tennis this weekend again. Tennis will be allowed, so individual sports will be permitted, but unfortunately, it's not possible for team sports to go on. It doesn't mean that sports is not important. I want to be very clear. You know, a healthy mind and a healthy body is truer than ever in 2020, but now it's a question of life and death. We must put in place some measures. We must make some sacrifices to stop this spread of the virus. We're doing this for a certain amount of time, and we hope that this will be as short as possible, but obviously, the more careful people are, well, the shorter that period of time will be. But we absolutely must make sure that we protect, amongst others, the functioning of our healthcare network. And as a premier, this is a decision that is not easy to make, to cut out certain artistic activities or certain sports activities, and to close restaurants and bars. But it's a choice that is necessary. for questions of life and death. So it's that important. What we tried to do, however, and you've surely noticed this, is we've tried to really save the schools. So children who are in a classroom will be able to continue to do sports. What we want to avoid in the red zones is that children in different classes practice sports where there are contacts with others. Why? Well, I've got a few numbers that demonstrate that currently we're at 822 classes that are closed in the private and public sectors. That means out of 1 million students, it's perhaps the equivalent of 2.5% of students who can't go to school. However, when we look at these schools that have an infection, an active infection, well, there's 666 of them. That means 22%. And that means that by having classes in bubbles, well, we can limit problems and keep it down to 2.5% instead of 22%. So we made the right decision to put in place these bubbles by classroom. And now, unfortunately, in the red zones, we also have to apply these measures to sports activities. It's also important to say the risk is a little bit greater with the elderly, with older people or older kids. So in high school, we're asking the students to wear the face covering as of Thursday in the classroom. We're also asking students in secondary 4 and 5 to come to school 1 day out of 2 to have fewer people per classroom. That is what we are aiming to do with public health. And all of this has the same objective, it's to keep as many classrooms open as possible. And in CEGEPs and universities, well, we can work for a certain amount of time with remote learning, so we are asking those establishments to teach online. But the message, and I understand that many things were said over the past few weeks, but in the end, we are saying that we have to reduce our contacts. Ideally, we should never be less than 2 meters away from another person with whom we do not live. So if we respect this, I'm convinced that we will be able to see the number of cases decrease over the next few weeks. Today, we want to talk to you about a new application. You know that when a person tests positive for COVID, people from public health will do some contact tracing to see if the people who were in contact with this positive case over the past few weeks, if they should be tested to try to limit the transmission. So today we are announcing an additional tool. We will continue to do contact tracing manually, and that's important to mention. But we've got a new app, and that is why I'm with my colleague, the Minister for the Government's Digital Transformation, Éric Kerr, who looked at the application under every angle to make sure that there was complete protection of personal data. It's important, and he came to the conclusion that it's reliable, it's secure. So public health, the government, or your contacts, nobody will be able to know where you are or who you're going to meet. It's only you who will keep that information for yourself. The application is quite simple to download. I'm taking a big risk here. I haven't registered yet, but I will do it in front of you. So you go in the application, you look at COVID Alert, you click on Get in the App Store, and here you have to identify yourself, and it wrote OK, so I am registered. So if I can do it, everybody can do it. I'll repeat myself. It's completely anonymous. It is not mandatory. It's on a volunteer basis. But what it allows us to do is quite simple, actually. It's to say that if you get COVID, if you are COVID positive, you call the call center, they give you a code, you type in the code in the app, and all of the people who were at less than 2 meters from you over the past 2 weeks are notified. Obviously, this is one way of telling them, go get tested. And I'm repeating myself, it's anonymous. Nobody will know that it's you who tested positive. And it's a way of slowing down the transmission and of eventually having fewer people who are ill. You will all understand, of course, that for the application to be efficient, we need as many people as possible to register. So the more people we have registered, the more efficient it is. So in Quebec, we are 6 million people who have a smartphone. So I'm asking right now, all those who are listening, go register right away before you forget about it. See, it didn't take any time at all. You go in the App Store and you get involved and try to convince your friends as well. I'll give you an example. I'm asking 2 people, and I know that they have a lot of fans, Marie-May and Julie Schneider. I'm asking them to go register, and I'm asking Julie Schneider to try tonight on her show to convince all of her viewers to register for this app. That way, we will create a big chain of solidarity, and the greater the number of people registered, the more successful we will be at breaking the second wave, and then we can go back to a normal life. I'm counting on you, all Quebecers. Thank you very much.
Everyone. The numbers from the past few days show that the situation is still critical, in particular in the Greater Montreal, in Quebec City, in Chaudière-Appalaches, and some areas in Gaspésie. That's why we've reinforced restrictions in red zones, including in schools. We must continue to do everything we can to limit our contacts. When someone has COVID, it's important to trace their contacts. This is what we're doing, and we ask everyone to continue to cooperate. Today, we're presenting a new tool to help us, the COVID Alert app. We wanted to be sure that there's no risk for the personal data of user. We have come to the conclusions that the app is secure. Neither the public health, the government, nor your contacts can know where you've been or who you've met. As you've seen, the app is very easy to download and use. If you receive a positive test, you will call and receive a code to enter into the app. It will automatically notify everyone who has the app and who's been in contact with you, but they won't know it comes from you. So they will only know that they've been in contact with a positive case and that they should get tested. The app will only really help us if many people choose to activate it. If you want to make a difference and return to a more normal life, please reduce your contacts and activate the COVID app. I also ask you to challenge your friends to do so. The more we are, the more lives we will save, the faster we'll break this second wave, and the sooner we'll return to a more normal life. I'm counting on you all. Thank you.
Thank you, Mr. Premier. So we will begin the question period. There are 2 microphones in the room. Oh, no, I think we have some remarks from Minister Kerr. Sure. Erika, the floor is yours. Well, listen, thank you. Thank you, everybody. Thank you, Mr. Premier. Yes, actually, today, I think that It's an important gesture that we're asking Quebecers to engage in by downloading the application. You know, we started this in the spring. The federal government announced that they wanted to go forward with an alert app. The government of Quebec wanted to have an approach that would be very inclusive from the population. We had some public consultations. We had a parliamentary commission. The National Assembly had a parliamentary commission where we wanted to have the debate because, as the Premier has said, at the heart of all this is the use or the onboarding. We need as many people as possible using the application in order for this app to be efficient. Once it is downloaded, there is a second issue, and that is that people who received a COVID-positive diagnosis must share this information, and obviously. So those are the two main issues that we face for this app to be fully effective. Now, I'd like to reassure all citizens of Quebec, this application, when it comes to security, it was tested by BlackBerry. It was tested by the Government of Ontario. It was tested by the federal government. And more recently, it was tested by the Centre gouvernemental de cyberdéfense du Québec to make sure that it was secure. And we often say that zero risk does not exist. But if zero risk did exist, this application is probably the closest thing to it. For example, in Ontario, 2.5 million citizens have downloaded this application, which has been in use for 2 months in Ontario, and to date, there have been no hacking cases reported. So when we say that it is secure, it's not just a theory, it's not just that it was tested. In daily practice, it was also the case, and we have to say that this application was downloaded, it was developed with open source software. So the entire international community can go see how it works, and if there were any security breaches, it would have been detected a long time ago. And in the different Apple and Google applications, the security issues were settled more recently with Google, who put at the disposal a patch to settle the last security issues that may have been detected. So it is safe, and we are asked, how do we protect confidential information? The best way to do that is to not use any. This application does not use any private information. So we cannot, thieves cannot steal what we're not putting in there. So I think that we can guarantee to Quebecers that it is safe to use this application. But please, download the application, use it, because yes, it works when everybody uses it. Thank you. We will begin the question period. Question. Hello, Mr. Premier. Today your government announced that students in high school should wear masks, even in the classroom. Your government is now announcing this COVID alert 2 months after it's been in use by several provinces. What do you say to people who say that your decisions are taken too late and this has had consequences on the spread of the disease? Well, let's take the two questions one by one. First of all, concerning the face coverings for children in classrooms, up until now, we did not have any recommendations from public health that indicated that it was necessary or that there was a risk that was significant enough to go forward with that. We've got a new recommendation from public health that tells us that we should, in high school, require the face coverings in the classroom. So when I say that I follow public health recommendations, this is a good example of that. The other question concerning the application, well, first of all, I've said this is an additional tool. It does not replace contact tracing. That will be done, and that is currently being done for each COVID case. There was an issue concerning personal data. And of the 4 parties represented at the National Assembly, there were 3 parties that were against the application because of the supposed risk to private information. So I took this seriously. I asked Éric Kerr to do the work in a detailed manner, and today we are confident that the app is fully secure. But once again, it's an additional tool. It does not replace contact tracing. It's in addition to it. Perhaps Dr. Arruda can add something? Well, the fact that it comes late, right? The masks in the schools, there's all sorts of jurisdictions that have imposed this a long time ago. So even if in Quebec it was not recommended, it could have been an additional tool. It's just these measures come late. We're all in the red zone now. You said that there are consequences for students in sports and in arts and all this. So this question of delays in the decision-making process, you have to understand that these decisions, I don't make them alone, right? I make them with a series of experts from the Institute, from the ministry, and directors of public health who look at the situation. We have to understand that the face covering is one element, one protective element, but it cannot be, but it's just added to the other elements like the bubbles in the classrooms. And now we have a tendency to focus in the schools on just the illness itself. And I think it's important, actually. We are acting now given the data that we have. However, for learning, for the integration, we still want to try to have a normal learning environment. Some people may think that the mask is easy, it's worn easily. For others, it's more difficult. So with the analysis that we had in Quebec of the situation, we wanted to work on the school environment. And even now, I find that the question of gatherings of young people, either before or after classes, is more important than the mask wearing, but we've added it. And I invite young people, because I think that young people are also part of the solution. We can't discriminate against them. Young people must be role models for each other right now. And I consider, and we're always victims of comparisons between territories, but with the scientific analysis that we had, with the consensus of experts, we believe that we are acting at the right time. If I make an analogy with a wound, a diabetic wound, right? Sometimes some will say, well, we'll amputate, but perhaps we should amputate earlier. But sometimes we can save the limb with an antibiotic treatment. But here, so we have acted in a way as to be impactful, and this contamination is not necessarily just associated to schools, but to community transmission. And that is why it's important that we all collaborate if we want to slow the transmission. And we know quite well that we're asking big sacrifices because, we're not happy to close down sports and arts, but we have to break the wave now. And I also think I would add that when we look at Ontario, right now, bars and restaurants are still open, right? It is a choice that is made by politicians and by public health. We want to protect, and as I said earlier, we want to continue to have sports in the schools. We have resisted, public health has resisted masks for children. So there's a choice that is being made to say, well, perhaps we will ask more sacrifices, for example, in bars and restaurants, and perhaps fewer in schools, so that we can have a more normal life. Because for us, and I've said this many times and I'm reiterating, the last thing that I want to close in Quebec is schools. Question? Hello. Mr. Premier, listen, a question. I want to come back to your meeting with the Aboriginal chiefs today. Over the weekend, there were several demonstrations by First Nations groups. There was a lot of frustration because of a very important fact that you've refused to recognize that there's systemic racism, whereas several reports show that there's systemic racism in Quebec. So my question is quite simple. Why do you and your government refuse to recognize systemic racism? Aboriginals find that it doesn't help the problem at all, and it's not going to be the solution to racism in Quebec. We've debated this topic this afternoon and what I explained to the Atikamekw chiefs is that there's a situation in Quebec that is not the same as what we see in the U.S. And we had that discussion when it came to Black people and also Muslims with what happened in the mosque in Quebec. And there's a part of the population that believes that there is not a system of racism in Quebec. There are some racist people. But the Quebec people are not racist. And I think it's important to respect everybody and to concentrate our efforts on actions and not on a semantic debate. And I think that we agreed with the chiefs today to say, for example, let's fight against racism, let's do an awareness campaign, let's make sure that there is cultural training for the employees of the different networks. That is what is important. That is what is important. And I think that, once again, I don't want to start judging all Quebecers. Quebecers are an open people. They don't like discrimination. And there are different opinions. Whether or not there is a system, a racist system in Quebec, we can certainly say that with everything that's going on in the U.S. and the slavery in the southern states, well, yes, there's a problem, a racism problem in the U.S., but in Quebec, it's up for discussion. And to me, it doesn't help to create consensus and to make everybody work and be on the same page. A sub-question. There are several communities as well who are asking for an apology from the government following Mrs. Joyce Chekwan's death. Does the government have the intention to apologize? I was asked that this afternoon, and I'm very open to that. So there will be a formal apology. We will find the right way to do so. But what happened to Mrs. Ishakhan is completely unacceptable. It is embarrassing, and the government, I'm ready to apologize to the family. Question? You talked, Mr. Premier, of the importance, the numbers, when it comes to cases in classrooms, in schools, how the bubble system was effective, but you still have, you're tightening the restrictions, and pediatricians who had fought for a return to school today are angry. They talked about a generational sacrifice when it comes to the secondary 4s and 5s, who perhaps will be left aside and they won't want to follow their classes. What do you answer to that? Is it really necessary today to make them spend 1 day out of 2 at home? Listen, we are in discussions with public health. In a perfect world, we would have to reduce the size of all classes. We would not have enough schools and teachers to do that. There is a higher risk with older children. Everything is a question of balance. The masks, we didn't make them mandatory like in Ontario for children in grade 5 and 6 because we think there are more negative effects and positive effects. Because yes, there's a question of public health, but there is also the well-being of the child and the context in which we put the child to learn, to socialize. So all of this, public health and us, we discuss these issues. Like I said, we follow the recommendations of public health, but at the same time, we look at what's being done elsewhere, and then we could take examples from Ontario or BC. We could take the example of the UK, of France, of certain states in the US who don't have all the same measures in place. So we need a certain balance, and I think that it's unfortunate that children in secondary 4 and 5 can't go to school every day. Listen, they're a little bit older, so perhaps they're able to be a bit more autonomous and independent for 1 day out of 2 and to work from home. But it's not ideal. It's not ideal. But it's a choice that we are making so that we don't compromise school for everybody. Now the questions, there was a second school today that closed near Longueuil, the Polyvalente Jacques Rousseau. Perhaps, Dr. Arruda, you can answer. How do we decide to close a school? Is it the number of cases, the number of classrooms? How do we manage all of this? Because now we're told that there is around 20 cases, but it's 2,200 students who are going home tomorrow morning. It's a decision. Well, first of all, there's no precise number. It's not a percentage of people in the school, etc. It's an analysis that is done for each one of the cases, because the 22 cases, are they all in the same classroom or are they through several classrooms? And all of this, and sometimes there are situations that are purely associated to the administrative side. It becomes more complicated to to keep the school open than to close it. So it's a decision that is made jointly with public health and the school, depending on the specific situation. You can have a classroom with 22, well, not 22, because we had a few cases in a classroom, and if it's just that classroom that we can close, well, then we do that. But if you have the impression that perhaps those children were in contact with other bubbles, well, people have to be in isolation before they go do their tests, and then there are some delays. So the school and public health can consider that perhaps it's easier to close right away, and people are in isolation, they go do their tests, and then when we get the results, we can see how we move forward. But it's very variable from one situation to the next. Question? I'm going to come back to what my colleague was saying concerning the Association of Pediatricians in Quebec, who say that it could be a generational sacrifice, yes, for secondary 4 and 5 students. What do you think about this? What do you answer to this? Do you think that we could talk about a generational sacrifice? Generally speaking, the pandemic did not help young people since March. And we've got some difficult choices to make, but there are also some choices that are musts, that we must make. There are some measures that we must put in place. These are issues of life and death. It's to save our healthcare system. We have to make sure that it can be functional. And this can have a negative impact on our young people. Our young people are not living a rosy period right now. I'm thinking about teenagers, amongst others. To get a boyfriend or a girlfriend, this is not the perfect time. And to socialize or to have fun, like young people, young people should be having fun. So why, then, you say that it's not a must? You could not have done it otherwise for these young people? Well, we have to make decisions. We have to take the less bad measures. And what I've understood from public health is that, especially for students in Sec 4 and 5, it's important to reduce the size of classes. But reducing the size of classes, there's not a million ways to go about this, but it's a recommendation, a firm recommendation from public health. And here we're talking about a transitory period, right? It's not until the end of the year. There's some work that will be done between us and the educational network to make the best decisions and to have a balance. I understand the pediatricians. I understand their opinion. I understand the parents as well, who are very worried. It's a balance that's very difficult to attain. There is no decision that doesn't have negative effects on somebody or on a group. But do you really think that in 28 days we'll be able to? Well, I would like the answer to be yes. I dream about the day where I will no longer see the numbers go up. Every night, I'm stressed and I look, are we still increasing or is it decreasing? It's still too early to see the effect of what we're doing, but if we can at least control, well, then we'll be able to reopen and we'll find some different ways to teach, on the web or whatever. And I think that the school environment will be sensitive to the people who have learning difficulties. There is an effort that will be made for their clientele. There are some young people who can go through this quite easily, others not so much. And I think that the schools are sensitive to this. But it's a big sacrifice. We are very conscious of this. And I just hope that it's not going to last for a long time so that we can go back to a certain freedom. And it will be a learning process and an awareness raising of young people of the importance of decreasing gatherings. Question. To go back to the COVID alert application, I'd like to know, what is the proportion of people who must use it in order for it to truly be effective? Well, on this topic, there are 2 studies that were undertaken, one by the Oxford University that says that if we use no other measure, no other public health measure, at 60% use, we can control the pandemic. There's another that was done by Google Research with the medical departments at Stanford and Oxford. And it's more a modelization which says that if we combine the app with other public health measures, physical distancing, contact tracing, well then we can have a ratio of use that is lower, but that will still lead to results. For example, at 15% use, we could see up to an 8% decrease in the transmission and 6% fewer deaths. And of course, if you increase the numbers of use, the use ratio, well, the efficacy will increase proportionally. And that is why we say that the more people download it and use it, the better our results will be, especially with young people. In the context that we're experiencing right now, where the contamination factors are present with young people right now, combined to contact tracing that public health continues to do, and to the measures that the government is announcing to slow the spread. So all of these elements combined, well, I think we would get a level of efficacy that would be very interesting. A question? To come back to what you just said, this application that you're announcing today, is it truly to reach more young people who are amongst the most contaminated right now? Well, listen, essentially, you have to understand that 76% of Quebecers have a smartphone. And these proportions are increasing or significantly higher with young people. The proportion of young people who have a smartphone is very significant. So yes, we can think that it could have a direct impact given the fact that the basic premise to have the application is to have a smartphone. With the new measures, we also believe that young people could have an additional interest in downloading this application. It's extremely simple. You saw the Premier make a demonstration. So it's very simple to download it. It's not complex at all. I've had it on my phone for 2 weeks now. And you just let it roll in the background, and all the work is done in the background. And the last step is that once you've got a positive diagnosis, obviously you need to call. And to have the phone number, you have to download the application. You call, you get a key, a unique key that you have to enter into the app. And then all the people that have been close to you in the past 14 days will be advised that they have been in contact with you, and they will get instructions as to what to do in case they get this alert. This summer, when you put aside the federal application, there was this question of personal data, but there was also where you justified your decision by giving the example of how things were being done elsewhere in Europe, to the effect that this type of application did not really work. So what has changed? Why are you changing your mind? Well, I would tell you that, on the one hand, there's some new information. I just talked to you about the study on the modelization. Well, it's a relatively recent study, so this kind of demystified this aspect. And also, I would tell you that the context and the second wave and the measures, the additional measures that the government must implement, and you heard the Premier, it was a difficult decision, but at the same time, it's a question of public health. So if you combine all of these elements, this is what explains that today. In English, we say that timing is everything, but I think the timing is right to launch this application, hoping that the population will be aware of the fact that this is a tool that is very simple to use. It's not complex. It doesn't require anything special. It just works on its own, and it can have a significant impact on our capacity, as Dr. Arruda said, to see the numbers decrease, and that's what we're all hoping for. English questions?
Merci. My question is for Mr. Claire. To repeat my question, it's the same as Annabelle's. What changed your mind? And also, what is the degree of participation needed for this app to be fully efficient?
Well, first of all, we don't change our mind. I mean, we always said if the situation change, evolve, we're willing to use that app. The situation clearly change in a negative way. So, as I said, timing is everything. I think the timing is good to use that app. And there is 2 studies about the level of using from people. The second one is more recent, said combined to other health recommendation, a level as low as 15% could give some good result. And as you know, we now announce a new measure, try to fight the pandemic, and using the apps is one of these measures.
My second question is for Mr. Legault. I want to go back to the same question that my colleague from Radio-Canada asked. The tension within the Atikamekw and also the other indigenous nations in Quebec remain extremely high, even though I understand you had a productive meeting. But there's a general consensus among those indigenous communities that it might be time now to recognize the fact that we have a systemic racism problem in Quebec, and that it's not just limited to racist individuals.
Okay. In Quebec, we have some people thinking that there's a system of racism in Quebec. There's also a part of the population thinking that there's no system. I think that what is important right now is that we have some people that are racist. Definitely at the hospital of Joliette, we had an unacceptable situation. So we have to fight against racism. We have to train our employees, including in our hospitals. We have to put in place a campaign to make sure that the people that are racist in Quebec, that they change their approach. And we had a very productive meeting saying that starting now we'll meet once a week and we'll take action and change the situation, and that is what is important.
We'll take the next question.
Matt Damour, CBC Montreal. The first question is for Premier Legault. You've talked a lot about the need for people to download this app for it to be useful and for the awareness to be there. Young people might be reticent because they might think that they are at less of a risk. Older people, I mean, we've all had situations where we have to help an older family member with a new computer or a new phone. It's not always easy. How do you ensure that people are going to, A, download this app, use it properly, and to report on the app if they get a positive test? I know that you've asked Julie Snyder and Matt May to put the word out here, but what is the government going to do to try to build up the awareness?
Okay, but I'm trying right now to convince people listening to our press conference to download the application. I think that when we see 1,000 new cases a day, it's clearly because we have something to do. We have to take action. I think it's an easy action. It's true that it's easier maybe for young people having this kind of iPhone or other intelligent phone. I hope they'll help their parents to do so if need is. But I think it's an additional tool. And at 50 new cases a day in July, in August, it wasn't maybe my priority, but right now to have an additional tool reaching specifically or more the young people is a good application.
My second question would be for Monsieur Carr and Monsieur Dubé. You've spoken about the fact that the government said that it wasn't closed to using this app if the situation changed. But public health officials have been telling us for a long time to expect a second wave. The commissions and the studies into the safety of this were done, and the results were released a month ago. The federal government was urging, and even Premier Ford in Ontario was urging the Quebec government to adopt this. People might say that the government is being reactive now rather than proactive and playing catch-up with these red zones already in full effect. What would you say to that?
Well, I think we just want to have a public debate about that. That's the reason why we triggered public consultation last July, and because the key word is download. If people download the apps, the app will be useful. If people won't download the apps, I mean, it could be useful, but not enough. So that's the reason why we want to have that discussion with Quebecers, and that's the reason why we want to make sure that people be reassured about the fact that there are no problem with their personal data. This app is secure. And now it's time. I think people are willing to download the apps. I hope they will receive the Premier message to download the apps. And if they do so, I think that app could be really useful to fight the pandemic.
And Mr. Dubé, just if you have something to add on the timing in terms of the health ministry and what this might do for Quebec's number of cases.
Well, I think the question is very important, I would say probably for young people. I think if we, in the last few weeks, as we realize how this pandemic was affecting young people and with the schools, I think those are additional reasons that after this parliamentary commission, we decided to go ahead with that. And I think we'll see in the coming days, but I had the chance to discuss that with the Minister of Health about 3 weeks ago in Ontario. The initial reaction was really slow, but I think in the last few weeks, as you saw our numbers, but also the numbers of Ontario, they saw a growth in interest for the application. And that's the reason we said we would be ready when we would think that's the right time, and I think the timing is right, exactly as Eric has just said.
We have also to remind that this last summer, we had the Liberal Party, the Parti Québécois, and Québec Solidaire saying that the app is dangerous for personal data protection. Did I want, with the other priorities I have, to start a fight with the three opposition party about personal data? I wasn't sure. That was taken into consideration.
Merci beaucoup. Merci tout le monde.
Merci tout le monde.
Merci tout le monde.